This leads us to the third and final piece of the puzzle, the one that impacts employers, the employer mandate. Beginning January 1, 2014, assuming the effective date does not get pushed back, large employers will have to offer all full-time employees quality, affordable health coverage or pay a penalty. A large employer is defined as an employer that had at least 50 full-time employees on average during the preceding calendar year. There are special rules applicable to part-time employees when determining if the employer had at least 50 full-time employees during the preceding year. It is critical you understand that the penalties apply to employers so that you can develop a strategy best suited for your organization. First, the employer penalties only apply if the employer had at least 50 full-time employees during the preceding calendar year. For example, if the employer only had 30 employees during the 2013 calendar year, then this employer is not subject to any penalties under healthcare reform. There are two ways the large employer can be penalized. First, there is a penalty if the employer does not offer coverage to full-time employees. Second, the employer does offer coverage to full-time employees, but 1, the coverage is not quality coverage, and/or 2, the coverage is not affordable. The first penalty scenario is the employer with more than 50 full-time employees does not offer any coverage. The penalty in this case is relatively simple to calculate. You take the number of full-time employees and subtract 30, and then multiply that number by $2,000, and that is the employer's annual penalty under healthcare reform for not offering health coverage. It is important to note that the number 30 is constant and does not change regardless of the employer's size. Let's look at an example of how to calculate the penalty for a large employer that does not offer health coverage. Assume the employer has 75 full-time employees and 25 part-time employees. The annual penalty for this employer is 75 less 30, which equals 45 times $2,000 or $90,000. This $90,000 is a non-deductible excise tax. For the penalty to apply, at least one full-time employee must go to the state-run healthcare exchange and receive federal assistance, i.e., a premium subsidy and/or the cost-sharing assistance. The second way a large employer can be assessed a penalty is if the large employer does, in fact, offer health coverage to full-time employees, but 1, the coverage does not meet the definition of quality coverage under the Obamacare rules, and/or the coverage is not deemed affordable under those rules. The government has issued rules to determine if an employer group health plan provides quality coverage. The insurance company or third-party administrator will be able to determine if your group health plan provides quality coverage, and we anticipate that most group health plans will meet this definition. Assuming the plan does, in fact, provide quality coverage, the plan also has to be affordable. The IRS has issued a safe harbor that says coverage is affordable for these purposes if the employee's share of the premium for single coverage does not exceed 9.5% of the employee's compensation as reported in Box 1 on the employee's Form W-2. Let's use the same example as before. Assume the employer has 75 full-time employees who are eligible to participate in the employer's plan. The employer offers health coverage to the full-time employees who contribute 20% of the premium for single coverage. Assume that the 20% employee contributions for single coverage translates to more than 9.5% of their W-2 wages. Let's assume that 13 of the full-time employees waive coverage and purchase their coverage through the state-run exchange and receive federal assistance. Additionally, assume 5 of those employees elect to participate in the employer's group health plan and pay the premium even though their share exceeds 9.5% of their Form W-2 wages. Finally, 2 of the employees elect not to get any coverage and simply pay the individual mandate penalty. Since at least one employee went to the state-run exchange and received federal assistance, the employer will be penalized. The amount of the annual penalty for the employer is the lesser of 1, the penalty the employer would have paid if it had not offered coverage, or 2, the number of full-time employees that actually get coverage through the exchange and receive federal assistance times $3,000. So, in our example, the penalty for this employer is the lesser of the following 2 calculations. First, the annual penalty for not offering affordable quality coverage would be 75 less 30 equals 45 times $2,000 or $90,000. The second calculation is the number of full-time employees, 13, that waive the employer's coverage and goes through the state-run exchange for their coverage and receives federal assistance. Hence, 13 times $3,000 equals $39,000. Since the employer is responsible for the lesser of the two amounts, this employer would pay a $39,000 penalty. Note that the second calculation is based on the number of full-time employees that actually went to the state-run exchange for their coverage and received federal assistance. The employer is not penalized for the 5 employees that elected to participate in the employer-sponsored group health plan. Also, the employer is not penalized for the 2 employees who decided to pay the penalty under the individual mandate rather than go to the state-run exchange for coverage. One strategy we anticipate some employers may adopt to avoid paying any penalty is for the employer to pay 100% of the premium for single coverage. Employers adopting this approach may also reduce or eliminate the amount the employer is currently contributing toward the cost of dependent coverage. In other words, the employer may increase the amount it currently contributes towards the employee's coverage and reduce or eliminate the amount the employer currently contributes toward the dependent's coverage. It is a little bit more complicated to calculate the employer's penalty if the employer is offering coverage that is not quality coverage and/or is not affordable. In this case, the penalty is the lesser of 1. The penalty that would apply if the employer did not offer any coverage, or 2. The number of full-time employees that waive the employer's coverage and goes to the state-run exchange and receives federal assistance times $3,000. Note that both examples show the annual amount when in reality the penalty is assessed on a monthly basis and therefore must be calculated each month. Finally, the penalty is a non-deductible excise tax for the employer. The government has not yet issued rules on how the employer will pay the penalty. All the government has said to date is that the healthcare exchange will notify the employer that an employee has applied for coverage through the exchange. This means that the employee is eligible for assistance and that the employer may be liable for the penalty. The employer will then have the opportunity to appeal that decision.